Researchers across the country, including in your area, are conducting a study that could include you or people you know. PREEVENT is a study that will look at if giving plasma earlier to patients with bad heat burns will help improve survival and lower complications. Plasma Resuscitation Early for evaluating volume and endotheliopathy of thermal injury. When someone suffers from a severe heat burn, their body loses a lot of fluid because the skin, which normally acts as a barrier, is damaged. This loss can cause blood pressure to drop very low, putting people at risk for shock. Burns also damage the endothelium, or the lining of blood vessels. This lining is a key factor in keeping fluid inside the blood vessels and helping the body fight inflammation. Plasma is the liquid part of blood. Doctors give plasma to replace lost fluids and to help keep blood circulation stable. Plasma also contains protein that helps repair the endothelium, which may help with keeping inflammation and swelling under control. Plasma helps with blood clotting as well. Giving plasma to patients with bad heat burns may help with fluid loss and may even help with fighting infections from the burn. Plasma is often already given to burn patients during the course of their care. This study aims to get plasma to badly burned patients as soon as they arrive at the hospital. In PREEVENT, patients may be given plasma shortly after arrival to a participating Lights research center. Regardless of what patients receive for this study, patients can still get plasma later in their care if they need it. Once a patient is determined to be eligible, a randomization process, like flipping a coin, is used to decide if the patient will receive plasma or the hospital's standard treatment, which could include salt water and/or a protein solution called albumin. This treatment will be given as soon as or shortly after arriving at a burn unit or burn center. The study is open label, which means everyone will know the patient's treatment. For this study, researchers will compare the two groups to see if one group recovers from their injuries better than the other. Researchers will collect information from medical records and may draw a small amount of blood at 2 time points as part of the study. Because treating severe burns is an emergency, there may not be time to get consent before being entered into the study. Patients may be too severely injured to give informed consent, and families may not be immediately available. As soon as the patient or their loved ones are available, researchers will notify them and give them detailed information about the study. Emergency studies must follow special rules and are reviewed by several groups of people to make sure that the study does not take advantage of sick people and that the possible benefits outweigh the risks. Before we do the study, we must make sure community members like you know about the study and ask for your opinion. For more information, please visit our website at www.lightsnetwork.org/PREEVENT.